Have you ever lost hope with a patient, seeing them around gadgets, breathless, speechless, and all you hope for is they could actually wake up again and talk to you? We're talking about critical care. In the period of COVID-19, the term ICU was common, and the only hope was with critical care specialists. Join me in welcoming Vallence Niyonzima, a specialist in critical care nursing, who also made it to the list of Mbarara University of Science and Technology's Heroes list. You're welcome. Greet these people and we should be able to start from that.
Thank you. Greetings to everybody. Like I've already mentioned,
Yes.
I am Vallence Niyonzima. I am the coordinator for critical care nursing at Mbarara University of Science and Technology.
Yes.
And I spearhead the training of students who are who are pursuing critical care nursing.
Okay.
Now, critical care nursing means providing care to the very sick patients, and in most cases we provide the care to those whose life is supported by machines,
Okay.
those who are not able to talk, and those patients whose relatives have actually lost hope.
Oh.
For me to join this kind of training,
Yes.
I was motivated by two patients I took care of during the time when I was doing my internship, where the caretakers repeatedly requested us to allow their patients to be taken home so that they could die from there. And the team that I was working with did not allow them to take these patients back home, and eventually these patients made it. So I was motivated to pursue this kind of training, given the fact that once these patients who are very sick receive the appropriate care, they can actually make it.
Wow. Very, very important. And that exactly one is what makes him a hero and worth celebrating. Well, you handle cases and situations where the family has completely lost hope, to an extent that, please no, let's take home, he will die peacefully and don't mind about this. When it gets to emotions, how does it connect with you people in there?
So of course, as you may be aware, when you take your loved one to the hospital, you are stressed because you are not sure of the outcomes. And when you see someone whose life is under the support of machines, it gets worse. And so one of our responsibilities is to give these people hope. And we do our best to make sure that these patients receive the best care we can provide, and that eventually optimizes their outcomes. And in addition, we also provide psychological support to the family members, because most of the times these family members break down seeing their patient helpless, not able to breathe on their own. But also, some of the health workers who actually provide the care to these kinds of patients end up breaking down, because providing care to someone who cannot talk to you, who cannot tell you are doing this, so I want you to do this, is also challenging in its own. So at times health care workers also break down, and it is again our duty to support our own brothers and sisters as we provide the care to these patients.
Yes. Okay, thank you. If we are to get into the numbers, how many are we looking at on a daily, averagely, in the ICU?
Now, thank you very much. So, critical care per se is not about numbers.
Yes.
In well-established ICUs, we are looking at one nurse providing care to one patient. And it is only when you have the right numbers of nurses that patients can receive the appropriate care and get good outcomes. So in settings where the nurse-patient ratio is not 1-to-1,
Yes.
usually the outcomes are not good. unless you have patients who are stable. There you can go for maybe one nurse providing care for 2 or 3 patients. But for the very sick patients, it should be 1 to 1. 1 patient to 1 nurse. And they
we could look at the most common cases in the ICU.
Yes. So the most common conditions in the ICU are road traffic injuries, mainly traumatic brain injury. We have patients who come in with a stroke. We have patients who come in with spinal injuries, and also have patients who come in with complications of chronic diseases such as hypertension, diabetes, kidney disease, to mention but a few. Yes.
Okay. Looking at the ratio that you mentioned a few minutes ago, and of course, and the number of challenges that one would actually put out within the line of work, could there be a call that you would wish to put out to authorities regarding critical care?
Thank you. So, first of all, I want to appreciate the Ministry of Health because it has been providing support to students who are pursuing critical care here at Mbarara University. What I didn't mention is that Mbarara University is the only university in Uganda that is providing training in critical care nursing, and we have received a number of scholarship opportunities for our students. There are a number of challenges, of course, that we face. To begin with, is that the training sites where we take our students are not to the level where we want our students to train from, because we are training nurses who will work in Uganda and abroad, and we would want to expose them to the best facilities ever. So my first request to the government is to improve the status of ICUs in Uganda, so that we have the best facilities for training, but also the patients we provide the care to receive the best services. Secondly, is that the staffing levels are still low. As I talk now, I am the only critical care nurse who is managing the program. Of course, there are other cross-cutting courses which do not require someone with critical care, but still there is a lot of workload for one person. So I would also request the government to improve staffing levels for these upcoming specializations, so that we can provide the best training to our students.
Okay, wow. Yes. Now, we may not be wowing challenges, but he is among the only 3 critical care nurses that we have in the region, and that is why we actually celebrate him today. As we end this, we could look at the, for whatever experience that you've been through, if you remember any heroic, of course I know there are many, if you remember a situation or case that you handled and you feel proud, you feel this should actually be written under your heroic name. Thank you.
So there are quite a number of moments that I can talk about. But there is this special case who was involved in a road traffic accident. The skull, he had a fracture of the skull and the brain was out. We were able to provide care to this young lady, and eventually she came out of the ICU walking. Wow. So that is one of the many cases that we have provided care to, and I am very grateful. Of course, it's not the nurses only, it is teamwork. Usually in the ICU it is teamwork. We have nurses, doctors, and the other healthcare providers who all work as one team in providing care to these very sick patients.
Okay, wow. On such a day, what message would you have for the public? It's Heroes Day.
Yes, the message I have for the public and specifically to my colleagues, the nurses, is to provide the best care to these patients. You never know when someone will become critical. There are patients who come in walking and eventually they become critical and they die. So my message to the nurses is to try their best, provide the best care they can to these patients.